Did you know that 1 in 3 adults will experience bladder issues at some point in their lives? Whether it's frequent bathroom trips, infections, or bladder discomfort, a healthy bladder is crucial for a healthy life. So, today we're diving into 12 essential tips to keep your bladder in top shape. Stick around, and by the end of this video, you'll have the tools you need for lasting bladder health. Tip 1. Stay hydrated. Staying hydrated is crucial because it keeps your bladder actively flushing out any bacteria or impurities, maintaining its health and function. Proper hydration helps dilute urine, reducing the concentration of any substances that could irritate the bladder lining, like salt or waste byproducts. This not only keeps your bladder comfortable but also decreases the risk of infection. Moreover, consistent hydration reduces the chance of kidney stones forming, which can place additional strain on the bladder. Drinking water steadily throughout the day, rather than all at once, helps maintain a healthy flow without overloading your system or creating urgency. Tip 2. Avoid holding it in. Holding your urine for long stretches can actually weaken the bladder muscles over time, impacting their ability to fully empty when you do use the restroom. When you resist the urge, it forces your bladder to expand beyond its normal comfort zone, which can lead to discomfort and even increase the risk of urinary tract infections, UTIs, as bacteria can multiply if urine remains in the bladder too long. By responding to the urge to go promptly, you help your bladder stay in a natural rhythm, which reduces strain and keeps your urinary tract functioning smoothly. Making bathroom breaks a priority is one of the simplest ways to prevent long-term bladder problems and improve comfort. Tip 3. Limit caffeine and alcohol intake. Both caffeine and alcohol act as diuretics, meaning they increase urine production and can lead to dehydration, which in turn irritates the bladder. Caffeine stimulates bladder muscle contractions, creating a more frequent need to urinate and potentially leading to urgency or leakage. Alcohol, on the other hand, impacts the signals between your brain and bladder, reducing your control over bladder function. Cutting down on coffee, sodas, and alcoholic beverages can ease these irritations, giving your bladder the chance to function more naturally. Swapping these drinks for water or herbal teas can make a noticeable difference in reducing overactivity and enhancing comfort. Tip 4. Eat a fiber-rich diet. A diet high in fiber supports bladder health by promoting regular bowel movements, reducing the likelihood of constipation, which can put pressure on the bladder. When the digestive system is sluggish, it often leads to a buildup in the intestines that can press against the bladder, causing discomfort and possibly leading to more frequent urination. By including fiber-rich foods like whole grains, fruits, vegetables, and legumes, you help keep your digestive tract moving smoothly, which eases strain on the bladder. Additionally, fiber supports gut health, which plays an important role in your body's overall wellness, indirectly benefiting bladder function by reducing inflammation and bloating. Tip 5. Maintain a healthy weight. Excess weight can put additional pressure on your bladder, especially as abdominal fat increases, straining the pelvic floor muscles that support bladder control. This extra pressure can lead to more frequent urges to urinate and may even contribute to stress incontinence, where sudden movements like coughing or sneezing cause leakage. By working to maintain a balanced weight, you reduce this strain, allowing your bladder to operate more efficiently and comfortably. A healthy weight also promotes better overall muscle tone, including in the pelvic area, which is essential for bladder health and control. Integrating regular exercise and a balanced diet not only supports bladder function but also boosts your general well-being. Tip 6. Practice bladder training. Bladder training is a technique that helps improve control over the timing of urination by gradually increasing the intervals between bathroom trips. This practice strengthens the bladder muscles, allowing them to hold more urine without causing frequent urges. Start by setting specific times to visit the restroom, resisting the urge to go in between unless absolutely necessary. Gradually extend the time between trips, teaching your bladder to adapt and hold urine longer comfortably. Over time, bladder training can reduce the sensations of urgency and improve overall bladder control, making daily routines more manageable. This approach also promotes healthier bladder habits by helping the body recognize natural urges without feeling pressured by sudden needs to go. Tip 7. Quit smoking. Smoking is not only harmful to the lungs but also impacts bladder health in multiple ways. The chemicals in cigarettes can irritate the bladder lining, which may lead to increased frequency and urgency to urinate. Smoking is also a major risk factor for bladder cancer. Carcinogens from tobacco accumulate in the bladder as the body processes them, heightening the risk of cellular damage. Additionally, smokers often suffer from chronic cough, which strains the pelvic floor muscles over time, potentially leading to incontinence issues. By quitting smoking, you not only reduce these risks but also allow your bladder a chance to function more smoothly and healthily, free from ongoing irritation and damage. Tip 8. Be mindful of certain medications. Some medications, like diuretics, antihistamines, and certain antidepressants, can influence bladder function by either increasing urine production or affecting bladder muscle control. Diuretics, often prescribed for blood pressure management, boost urine output, which can lead to frequent bathroom visits. On the other hand, some antihistamines and antidepressants can relax bladder muscles, potentially making it harder to fully empty the bladder. Being aware of how your medications impact your bladder helps you take proactive steps, like adjusting fluid intake or discussing alternatives with your doctor if side effects become troublesome. This mindfulness around medications is an important part of managing and supporting bladder health. Tip 9. Avoid artificial sweeteners. Artificial sweeteners like aspartame, saccharin, and sucralose can irritate the bladder lining, causing increased urgency and frequency in some individuals. These sweeteners may also act as diuretics, prompting the body to produce more urine and leading to more frequent bathroom visits. For those with sensitive bladders, these additives can exacerbate symptoms, making it difficult to maintain bladder comfort. Switching to natural sweeteners like honey or stevia, or reducing sweetness altogether, can help your bladder maintain stability and ease irritation. Paying attention to sweeteners in diet sodas, sugar-free snacks, and other processed foods can go a long way in supporting bladder health. Tip 10. Incorporate pelvic floor exercises. Engaging in pelvic floor exercises, commonly known as Kegel exercises, can significantly enhance bladder health by strengthening the muscles that support the bladder and urethra. These exercises involve contracting and relaxing the pelvic floor muscles, which helps improve their tone and endurance. A stronger pelvic floor can enhance bladder control, reduce instances of leakage, and help manage urgency more effectively. Regularly performing these exercises not only aids in preventing incontinence but can also enhance sexual health and pleasure. Incorporating pelvic floor exercises into your daily routine can be a discreet yet powerful way to promote overall urinary health and provide greater control over bladder function. Tip 11. Wear breathable underwear. Choosing breathable underwear made from natural fabrics like cotton can significantly benefit bladder health by promoting airflow and reducing moisture accumulation. Unlike synthetic materials, which can trap heat and moisture, breathable fabrics help keep the genital area dry, minimizing the risk of bacterial growth and irritation. This is especially important for those prone to urinary tract infections or other bladder-related issues, as a damp environment can encourage the proliferation of harmful bacteria. Additionally, breathable underwear can enhance overall comfort throughout the day, allowing for greater ease of movement and confidence in bladder control. Making this simple switch can lead to a healthier environment for your bladder and contribute to better overall hygiene. Tip 12. Get regular check-ups. Scheduling regular checkups with your healthcare provider is essential for maintaining optimal bladder health and catching potential issues early. These visits allow for comprehensive assessments, including discussions about any urinary symptoms you might be experiencing, such as urgency, frequency, or discomfort. Early detection of conditions like urinary tract infections, bladder inflammation, or more serious issues can significantly improve treatment outcomes. Additionally, these appointments provide an opportunity for you to review any medications, lifestyle changes, and health strategies you've implemented, ensuring they align with your overall health goals. Being proactive about your bladder health through consistent checkups fosters a deeper understanding of your body, empowering you to make informed decisions that support urinary wellness. So, there you have it, 12 essential tips for a healthier bladder. To recap: 1. Stay hydrated to flush out toxins. 2. Avoid holding it in to prevent strain. 3. Limit caffeine and alcohol to reduce irritation. 4. Eat fiber-rich foods for digestive and bladder benefits. 5. Maintain a healthy weight to relieve bladder pressure. 6. Practice bladder training to manage urgency. 7. Quit smoking to reduce bladder risks. 8. Be aware of medications that may irritate. 9. Avoid artificial sweeteners for better bladder comfort. 10. Do pelvic floor exercises to support bladder muscles. 11. Wear breathable underwear to prevent infections. 12. Schedule regular check-ups to stay on top of bladder health. With these tips, you're set for a healthier, happier bladder. Remember, small lifestyle adjustments can make a huge difference. If you found this video helpful, please like, subscribe, and hit that bell icon for more health tips. Until next time, take care.